or are we? Great. Okay, we're going to get started now, everyone. Welcome. I would like to start by acknowledging that we at the University of British Columbia, located in what settlers refer to as Vancouver, British Columbia, are gathered today on the traditional, ancestral, and unceded territories of the Musqueam people. And I'm honored to live, work, and learn on these lands. And in addition, as this is a virtual seminar, we have people joining from across the country and possibly even outside of the country. So from coast to coast to coast, I acknowledge the ancestral and unceded territory of all Inuit, Métis, and First Nations people that call this land home. So good afternoon or good morning, depending on where you are joining us from, and welcome to this exciting joint seminar that is hosted by the UBC Edwin S.H. Leong Center for Healthy Aging and the University of Toronto and Sick Kids Edwin S.H. Leong Center for Healthy Children. I'm Kim Schmidt. I'm the research director of the UBC Leong Center for Healthy Aging, and it's my pleasure to open today's session. We're delighted to bring together two series as part of this session, the Healthy Aging Research Seminar Series and the Leong Center Rounds, each dedicated to advancing critical areas of health research and policy. The joining of these two seminar series allows us to bring together experts in child health equity and healthy aging, creating a unique opportunity to bridge generational health perspectives and foster holistic approaches to well-being across lifespan. I encourage everybody to participate actively in the discussions, ask questions. The joint seminar is not just about sharing knowledge, but also about building connections that can lead to impactful change. So with that, I'm very pleased to welcome our speaker today, Dr. Kiffer Card. Dr. Card is an assistant professor with the Faculty of Health Sciences at Simon Fraser University. He has received training as a behavioral epidemiologist, social ecologist, and health services researcher. Over the past 6 years, his research program has provided training to future scholars and raised awareness of key social reforms and policies that aim to help Canadian leaders build happier and healthier communities. In pursuit of this aim, Dr. Card has participated in nearly 100 funded research projects, published more than 200 articles, and trained more than 50 early career scholars, a really impressive accomplishment. With a focus on loneliness and social isolation, Dr. Card's work is helping reform Canada's health systems to better attend to the social health needs of individuals and communities. And today he's going to tell us about the importance of healthy, happy, and connected communities for lifelong health. So with that, I will turn it over to you, Dr. Card.
Thank you, and it's great to be here with you today. As was kind of mentioned in that great introduction, thank you for your generosity. I think really presenting a thesis today on just how important social connections and relationships are to our health, to how we run public health systems. I think this is something that many of us intuitively know. We know that those of us who are in relationships with other people, which would be almost everyone, we know how much power a relationship has in shaping our happiness, our sense of peace and belonging in the world, our sense of obligation and duty to other people. And basically every decision that we make is a social decision. Of course, as we think about aging and the significance of aging and its health, I think tending to social connection as a broader view of what health is something that we have been saying we would do for decades as we speak on the social determinants of health. But really since the COVID-19 pandemic has not received the attention that it deserves. I want to acknowledge that I'm joining from the land of the Songhees and the Kwangin speaking people. And I'd like to acknowledge that just because of how much of what I will share today is just new words for old knowledge, and that we have really drawn on Indigenous principles about our interconnectedness, about our relatedness, and that had our society been aligned with those principles from the beginning, much of what I'll share in my presentation probably wouldn't be relevant today. We wouldn't be facing, crises of loneliness and disconnection, because we would have made it a priority fundamentally from our understanding of health and well-being. So I want to honor Indigenous peoples and the wisdom, and remind us that we're all Indigenous from somewhere, and all of our ancestors had suffered colonialism and imperialism and feudalism and industrialization and these other long-run social processes that have stripped us from our connections to our place and from each other. And I think we have much to learn from Indigenous people who continue to experience that oppression under existing colonial systems, something my ancestors have been spared for many generations, but is still fresh wounds for many of those in North America and throughout the world. So in talking about the presentation today, I've really broken it down into several sections. And the first thing is really my best attempt to make you think that my research area is the most important research area that we should be addressing. And I want to start that with a reflection back on our Indigenous, ancestry. Scientists in biology kind of say that the human mind in its kind of current form has kind of been developing over kind of this 1.8 million year time span. And I was exposed to this idea of this timeline a few years back with this activity. And so I wanted to share this activity with you to have you experience what I experienced when I first encountered it. And maybe you're just much smarter and better read than I am. But for me, this was really profound to see. Basically, I was asked to put these events on a timeline of that 1.8 million long story of humanity. And so the 6 events that I ask you just want to, on this timeline, place where you think they occurred, more in the middle, more on one side, don't have to get it exact. But humans outcompeting Neanderthals is the first one. The second is the advent of civilization, which kind of is a broad category for, we stopped living nomadic lives. We started living in sedentary, tied to specific plots of land. The advent of agriculture and the advent of domestication of animals into helping us with agriculture and also our food supply. The invention of writing, the development of contemporary religions, the invention of the nuclear family. So, nuclear family being the father's, mother, son, daughter, grandparents, siblings, kind of network style of thinking about relationships. And then the emergence of the internet. And of course, that one is very easy for all of us to place because many of us were alive when the internet first kind of emerged. So I'll give you just a second to place that. Now, of course, I think it's worth noting that 1.8 million years is a very long time and hard to really cognize. So I want to maybe for giving you the answers, break that down into 100 minutes. And the way this story was originally told to me was a 100-minute movie. So if you imagine you're watching a movie about all of human experience, and it's all condensed down into 100 minutes, what does that look like? And this is the answer, which is, for me, really stunning. We only outcompete Neanderthals when there's 1 minute left to go in the movie, which to me is just mind-boggling. The advent of civilization, there's just 30 seconds before the movie ends. The invention of writing, just 15 seconds ago. The development of contemporary religions, 10 seconds. The invention of kind of the nuclear family, just 5 seconds left before the end of this 100-minute movie. And then, of course, the emergence of the internet, just a mere millisecond left. And the way that this exercise caught me off guard is just the reminder about the extent to which the pressures of evolution in developing the human brain and in developing the human experience have so rapidly changed in just the very last few millennia. And so, of this kind of long run history, we're living so differently than almost all of the sapiens before us have lived. And I think that really highlights this vulnerability that humans experience in our mental health and well-being, and perhaps provided an explanation why, despite having more wealth, more power, more connection than we've ever had before, the level of dissatisfaction, mental angst, challenges that people face still continues to be quite pressing. And the argument is essentially that we have sort of created an evolutionary mismatch the environment in which we exist now is not the same as the environment in which our evolved neural machinery was developed for. And I like to use this phrase that in some ways we've created an anti-human society in which things like anxiety, depression, loneliness are just the natural response that a human being elicits when they're exposed to the sort of stimuli that they're exposed to. And among these kind of various factors that have changed our experience, I think one of the most important is the evolution of our social relationships. If you think about for almost all 1.8 million years of that timeline, human beings lived in small hunter-gatherer tribes of 30 to 50 people, maybe part of a larger network of around to 150, but nevertheless, you knew the people you were surrounded with. And for the most part, you knew them throughout the entire duration of your life. And so you were also highly dependent on them for your survival in very obvious ways. When you faced a challenge, it was your group facing a challenge. And so obviously the way that we built up cubicles and single person vehicles and isolated housing and little apartments and phone use, all of these things that we now think of as really common to our environment really serve to disconnect us from one another. And this creates experiences that you and I are very familiar with of this concept of loneliness, that loneliness is this signal, similar to, say, hunger and thirst, that is there to tell you that you're not getting as much social connection as you need. So thinking of loneliness in this way is called an evolutionary perspective on loneliness, that fundamentally we as social animals need each other. And so your body, in order to get you embedded within a social network, gives you the unpleasant dysphoria of loneliness in order to promote you to get socially connected. And so there's been a lot of work in recent years to understand that, say, since the 90s, that loneliness really does appear to be related to the neural systems that kind of monitor your social condition, your social status. Each person might vary in the level of social connectedness that they need, but nevertheless, when they are below that level, they react to that deviation in a set point and experience that unpleasant dysphoria. Neural imaging studies also show that this kind of operates in the same way that pain, loneliness, hunger, thirst, suffocation, all of those unpleasant dysphorias, which are there to motivate you to get food and water, to retract from pain, to breathe, really appear to operate in much the same way that loneliness does. We also see that lonely individuals experience activation of the HPA axis, which is your kind of evolved fight or flight response. The HPA axis floods, of course, your body with cortisol. And that cortisol, when exposed for a long time, begins to have deleterious health effects, particularly in terms of inflammation, cardiovascular health issues, cancer-related issues that are driven by this. So it's very clear that in these ways, the sort of environments in which you exist, and particularly your social environment, but also your natural environment, really do seem to get under your skin in this way to drive some of the negative responses that you experience, in terms of mental health, and loneliness being one of those experiences. Now, as many of you are interested in aging and aging experts, I think it's really interesting to think about how loneliness has changed, how loneliness affects us as we age. And in particular, these are trends from the Canadian Social Connection Survey, looking at two types of loneliness: the emotional dimension of loneliness, so having somebody that you feel intimately connected to, that you can go to for kind of that emotional and social support needs that you have, and then social loneliness, which is your sense of broader inclusion in the community. And there used to be this really strong trend in a lot of research in that we would see like kind of an inverse U relationship between loneliness and social isolation. But it appears really since, I'd say, 2009. And so with the emergence of the internet, social media, cell phones, that has kind of leveled off. And now the levels of loneliness that we see in young people are so high that it looks like you're experiencing a decline in loneliness over the life course. But of course, we know that many seniors really do experience these high levels of loneliness. I think for those of you who are, aging scholars, I think there's two really important theories about social relationships and social connection. So many of you may be familiar with these, but if you're not, the two that I think are really important is socio-emotional selectivity theory, which basically says that as you age, you begin to invest in those relationships that are most rewarding to you. And so the classic example is, as a grandparent, you're really investing in those relationships for your grandkids and your children and your family. Whereas when you're younger, you may be more willing to expend some relational energy on a broader social network of friends. And the second theory is the convoy model of relationships, which is ultimately of how social networks form. They tend to form as a convoy in early adulthood, and then you kind of move through life with that convoy. And over time, individual members of that convoy get picked off. A good friend moves across the country, your partner, dies, your children move out of the house. And so these processes create a lot of vulnerability in older aging because people tend to focus on those most meaningful relationships, but then at end of life, the natural processes and social processes take hold, and that network begins to disintegrate. And so loneliness is something that affects everyone across the life course, has particularly emerged as important for youth, but has a lot of vulnerability in old age too. So no matter what stage of the life course, or if you're interested in the whole life course you work in, I think this is really important theories for you to think about. Now, the other important, I think, way of thinking about this issue is to really think about social well-being as a dimension of health. Of course, we've recognized since 1946 that health is a state of complete physical, mental, and social well-being. And while I think in public health, we've done a really good job in educating people about their physical health, we're increasingly doing a better job about increasing people's understanding of mental health, reducing stigma, making people aware of things like mindfulness and other evidence-based practices. But we haven't done as much to help people understand the importance of social connections in their relationships. And I think this is significant because, if given the choice about how I'm going to spend my afternoon after work, I could go to the gym, I could go home and make sure I cook a really healthy dinner, or I could, go hang out with friends. And if people don't understand the comparative benefits and trade-offs of those, then they might not be making the right choices. So I think from a public health perspective, educating people about the importance of social connection is really critical. Of course, it's important to recognize that not all experiences of loneliness are the same. Certainly, some of us experience loneliness on a fleeting basis. You might experience it as FOMO, fear of missing out, when your friends are out partying or out, see their posts on Instagram, and you feel a momentary sense of disconnectedness because you were excluded or felt left out. Sometimes loneliness is just situational. You've just moved to a new city, you've just retired from your job, you've just experienced the loss and death of a loved one. And so you're experiencing loneliness because of the nature of your situation, but it would naturally resolve. Interpersonal loneliness might emerge when there's some social conflicts, social comparison, alienation, these sort of things that you're experiencing that might lead then to chronic loneliness, which is that, often driven by experiences of inability to access the social resources that you need to thrive. And so that may come from chronic illness or disability, social anxiety, shyness, fear, phobias, or just poor social and emotional functioning. And so, of course, that chronic loneliness is what we in public health have really come to understand as being the most deleterious effects, because it traps individuals into a cycle of loneliness in which all of those disease processes related to the HPA axis activation, which loneliness appears to activate, begin to cause inflammation in the body, dysregulation of metabolic processes, and most notably impacts on heart health and well-being. So increasing risk for stroke, increasing risk for myocardial infarction and other heart-related conditions. And of course, we call it the cycle of loneliness because individuals appear to get trapped in it. A lonely individual who, if loneliness is thought of as this stress response or stress trigger that's supposed to get you to go out and get connected, that's really important to be aware of because stress also causes vigilance. Those processes are tied. If you think evolutionarily, throughout almost all of human existence, being disconnected from your group was probably one of the most endangered experiences you had, because disconnection from your group would mean that you would probably have difficulty gathering enough food, you'd probably be vulnerable to predators, and most importantly, you'd be vulnerable to other tribes who might not trust you or take you in, and therefore, when encountering them, they may kill you. So that creates a sense of social vigilance in individuals, which we still see today. You can put people, in isolation, even over a sense of a few hours, and change their responses to, economic gains. They act in more self-interest. They become more skeptical, less trusting of others. And so that social vigilance causes them to socially withdraw. And of course, when you withdraw, your social state hasn't improved and you experience more loneliness. And so if people aren't able to achieve the social connection that their body's trying to get them to do, then it appears that there's a lot of risk. And this is substantially becoming a norm in contemporary life. In data from the Canadian Social Connection Survey, if we use the UCLA loneliness scale, about 40% of people are classified as lonely. Angus Reid, pre-pandemic, found a similar number, about 40% of Canadians experiencing some level of social discohesion in their lives. About half of those who are classified as lonely on the UCL scale in Canada do experience loneliness on kind of this chronic and ongoing basis. And if that's not you, if you're not experiencing that, 70% of the people that we surveyed say that they experience this. And there really is, evidence, even in our data, even in self-reported data, that this has negative impacts on people's health and quality of life. We see that there's a greater frequency of loneliness. So the more episodes of loneliness that you experience, the longer duration of loneliness. So if loneliness has been this way for years for you versus a shorter amount of time, and greater severity of loneliness, so higher scores on a scale measuring intensity of loneliness. Each of those independently predicts poorer self-rated physical health in kind of a dose-response pattern, as you can kind of see in figure 2, looking at the increased odds associated with being loneliness for each of those durations. And so stopping loneliness is really important. Of course, it's not always easy to do because people, as they become more lonely and socially isolated, there is a non-linear relationship with that intensity of their loneliness. And so the longer people have been lonely, they may subjectively begin to adapt to that level of loneliness. And so sometimes when you say talk to a senior who has been isolated for a long time, they might say things like, well, I'm actually comfortable in my loneliness, or I prefer it this way. And so people do kind of get, again, trapped in that cycle of loneliness. We kind of see that in our data, even over short periods of time. And all of this evidence points to this reality that we underestimate the importance of social connection in our relationships. If you look just at the empirical data, in terms of the relative risk for premature death, poor social health has worse consequences than poor air quality, than being obese, than living a sedentary life, than drinking 6 alcoholic drinks a day, which is the marker for binge drinking, and smoking 15 cigarettes a day. And so this is a pretty profound level of health disruption, considering that classically we've long said that smoking is the #1 cause of preventable death. We spend massive amounts of money on anti-drinking for health protection and health promotion. Your doctors will weigh you and measure your BMI, will ask about your physical activity levels. And we have huge regulatory systems to protect our air quality. But yet we don't have the same level of public health intervention or interest in social health. And I think that's what's beginning to change since the pandemic. And of course, it's not just the health impacts, but I think all of us sense that there's an erosion of our social fabric. Increasingly, it's clear that people with smaller, less dense social networks, they tend to be more polarized. We find that loneliness appears to be a major driver between the development of conspiratorial views, again, thinking about that cycle of loneliness, that social vigilance that loneliness seems to trigger. We see that it's related to more neoliberal and anti-government beliefs among lonely individuals. And so, and a lot of the extremism that we see in politics arises because lonely individuals find community in, what could be described as the wrong places. They're finding communities in ideological settings that may drive them to extremist views in that search for belonging. Just as like we might think of, as a way to escape the painful mental anguish of being alone, using substances, engaging in other risky behaviors to try to divert your attention from that experience has these profound consequences. So, kind of in review, we kind of need this greater investment in social health and well-being that, there's long been this understanding that most of the determinants of a person's health and the health outcomes are non-medical determinants. These are the social and environmental determinants of health. So 80%, of what determines your health has nothing to do with how many doctors there are, how many emergency rooms or clinics or nurses. We know that there's a dramatic increase in the risk of death among those who have poor social health, ranging from 30 to 50%. We know that huge proportions of people in Canada experience loneliness some or all of the time. And if you look at those who are chronic loneliness, who experience it often or always, according to Stats Canada, that's about 15% of people. So again, kind of matching that half of people who are lonely experience it chronically. And yet we only spend about 5% of our medical budgets and healthcare budgets on promotion and health prevention. And so I think that really highlights this mismatched priorities. And I think to address loneliness, we really need to take a more active approach. And that even comes out on an individual level. We see that individuals who engage in active coping and emotional response over time in our cohort, they see declines in their experiences of loneliness because they're actually addressing the issue. Whereas those who give up, who accept that loneliness is just the way their life is, that that's just the social situation they have, when they use substances to try to escape those painful experiences of loneliness, or when they, instead of trying to solve through seeking out social support, they simply vent about their negative experience with loneliness, we see that those individuals actually increase over time in their experiences of loneliness. We also looked in a variety of models in our data to really understand what are the major drivers of loneliness. And as what we tend to find is that there's, some proportion of this that is demographic. Your age and your income are two of the strongest predictors of experiences of loneliness from a demographic perspective. And a lot of that's because of your abilities that increased wealth gives you to be social. Health correlated with aging has an ability to support you. And of course, age stigma, chat makes connecting across generations very difficult. And so we do see that some level of experience of loneliness do have to do with those kind of traditional demographic factors. There's also personality factors, variation, for example, in extroversion versus introversion. But we did an important study where we showed that actually when introverts are deficient in their needed level of social connection, they actually experience worse health impacts. Extroverts appear to be a little bit better able to manage their deficiencies in social connection. Two or three really big areas is these attachment styles. So the way you form bonds and relationships with other people appears to be really important in terms of predicting your vulnerability to loneliness. And also that's related to your self-concept, so your general sense of self-efficacy, your self-esteem, your body image, those appear to be really important. And I would say if there was any indicator in our data sets that really correlates strongly with this, self-esteem is really important, that how you view yourself and how you view your relationship to others appears to be very closely related in terms of the neural machinery behind loneliness and self-esteem. Then, of course, the next big model 5 there, the interpersonal variables, the actual objective descriptions of your social connections and relationships. So do you live alone? Do you have 3 to 5 friends or more close friends? Do you receive good social support from family? That objective reality of your situation appears to be kind of important. Also the community that you live in. So the housing, how long you've lived there, how cohesive your neighborhood is, whether or not you, live in a small studio apartment or somewhere where it's more easy to have friends over. And then finally, the cultural aspects of your community, particularly, how competitive or self-reliant or sense of obligation to others do you have, appears to also be important. So all of this, each of these are independent models because we didn't have one data set that measured all of them, but you kind of get a sense of of where the big factors are. But even in some of these smaller ones, I'd like to point out that we usually think around the heritability of loneliness to be about 50%. And so in what is not somebody's own biological set point vulnerability to loneliness, even something like improving somebody's neighborhood environment might have a substantial impact on their well-being, because we can think of things like personality and attachment style as maybe being largely biologically driven. And so this is why we've thought that we really need a framework for addressing these issues. And so we've really set out to develop these public health guidelines for social connection, similar to food guidelines for nutrition, alcohol guidelines, and exercise guidelines. We want to provide kind of the evidence-based practice for what is needed for people to live healthy social lives. And so we've developed 6 guidelines for individuals, encouraging people to actually make social connection a priority, to know that it's important to their health and well-being, to cultivate that healthy social outlook and sense of self, helping people address the emotional difficulties that may come from things like social anxiety, building that strong and diverse social network that gives you a variety of types of relationships to get what you need out of connections with other people, making sure that you're giving it enough social connections so that you actually do have enough friends and that you're spending enough time with them, to deepen those relationships that you do have. A lot of our relationships get stuck at kind of a surface level, and that surface level forms of connection usually isn't enough to meet for example, your emotional needs that you need as a social animal. And then finally, to seek out, use technology wisely. I think many of us are familiar with the negative health impacts that have been documented with some forms of technology use. Of course, not all, because lots of technology use is really good. I can use my phone to call my mom, even though she's thousands of miles away, for example. But we also recognize that other guidelines usually miss the mark in that they only focus on the individual. And so in our guideline development process, which consulted more than 100 of the world's leading experts in social psychology and community development, we wrote over 40 evidence briefs whenever contention or difficulty kind of emerged that process. And those 40 evidence briefs review all of the literature that we could find on given topics and questions. And through that process, it also emerged that it was necessary to create environments so that if you're going to tell people to eat their fruits and vegetables, you need to make sure that fruits and vegetables are available in their environments. And so these 6 guidelines for communities to promote awareness of the importance of social connection, to foster healthy social and emotional development, to make social connection a priority in policies and practices whenever possible, to build communities for connection and invest in social events, activities, and programs, to improve accessibility and inclusion for all people, because we know, for example, disability, aging, all these sort of issues become quite critical. And then also to actually measure and make progress towards social connection. And we're working with, for example, the Public Health Agency of Canada to look at alignment between the guidelines and existing surveillance and monitoring indicators. And so really, I think the development of these 12 guidelines, 6 for individuals and 6 communities, highlight is we really need a full spectrum social ecological intervention that supports social connections across the life course. And other countries have recognized this too. In 2018, the UK appointed a minister of loneliness. Japan followed suit in 2020. And that has led both of those countries to begin to develop policies and frameworks for addressing social isolation. There's also interventions on the individual level that help people develop and improve their social skills, enhance social supports, increase opportunities for social connection, and improve their social cognition. In the UK originally, but now so in Canada, there's a lot of expansion of interventions called social prescribing, which is where a doctor actually identifies people experiencing loneliness and then refers those individuals to a community navigator who can help them find the sorts of supports that they might need in their community, tailoring, say an arts program or a nature program or volunteer opportunities to that person's individual social, emotional, financial, material needs. There's the public health guidelines, as I mentioned, to complement the other suite of guidelines. If we think of since the 1940s, the development of food and nutrition guidelines and exercise guidelines in public health, a lot of those early innovations actually came from Canada. So I think it's pretty fitting that we've also moved forward in the connection of social connection guidelines. There's investing in social groups and clubs. And I don't think that's just like the long, history of fraternities that have existed in North America, for example, from Freemasons, but new innovative things, finding ways, say like the BIPOC Birding Club of Wisconsin is a good example, Queers and Beers, which is a local community driven efforts, men's sheds, which are workshops that older men and younger men as well can go to find social support and connection. All of these sort of innovative interventions that provide the opportunities are also needed as part of that big whole of society approach. Building environments and housing in a way. I think great examples of this, at least here in Vancouver, are the Hey Neighbor Collective and Mini Village, both of which work with housing providers, particularly in social housing settings, to increase connectivity of residents, to think about how you design a facility to encourage rather than discourage social connection and integration, and then program around that. And then there's even these little things like, little things that act as signals for social trust, for social capital, for social cohesion. Things like little libraries where you can see what your neighbors are reading and they experience the pro-social joy of having somebody share a book like that. Things like these pay it forward boards where you can buy somebody a meal and stick the receipt on a bulletin board. And then if somebody needs a meal, they can take that to the counter and it's already paid for. Community gardens where communities work together to create sustainable food supplies. All of these sort of little acts as signals to an individual that their community is safe and well-being. And I think throughout all of these different types of interventions, it's really clear that what we need is not just a series of long-run pilots. In Canada, we're really good at doing pilots, but we actually need to make substantial investments in these by identifying what are the most effective strategies to address loneliness and social isolation, and then what can we do to actually get those sustainably funded. And so this requires not only the work of psychologists and epidemiologists to think about those fundamental human social needs, but also systems thinkers, design specialists, health service providers to think about how we can integrate those in sensible ways to really reorient our healthcare and social systems away from just treatment, but towards prevention, away from just a biomedical model to one that recognizes human beings as social animals that need social support as a key determinant of their health and well-being, that helps educate people not just about individual behavior in this domain, but recognizing that communities, social connection requires at least two people. So we can't just think individualistically, we have to think about communities and collectivism across those individuals. And I think as we work towards reorienting the health system and the social systems to really recognize that social connection is an important and salient determinant of health across the entire life course, and that the earlier intervene, the better. I think that we will be better and more effective at addressing these public health needs. So with that, thank you for taking the time to attend this webinar. It's great to see so many people joined. I think we now have 20 minutes or so for questions.
Thank you so much for a great presentation. I'd like to ask now that if folks have questions, please feel free to raise your virtual hand. You're also welcome to leave your questions in the chat. I'll keep an eye on that for our speaker and make sure to bring that to his attention.
One
I have
thing
one.
I'll
Oh, sorry. Does somebody else have one? I was just going to say I have one that I was to get us started or.
No, I was just going to say, I'm going to throw the link to the social connection
Oh,
guidelines
perfect.
in the chat. So you have that web link for everyone. But yeah, go ahead,
Okay,
Kim.
thanks. Yeah, I was just curious. It's just thinking about the importance of social connection across the life course. And I know in schools, at least in BC, there's been, this big focus on teaching kids more life.
I think I've lost
Yeah,
Kim.
I think we might have lost Kim there for a second, but oh, there
Oh,
you
did
go.
I?
Okay.
Sorry,
Sorry,
I
we
think I
heard
froze for a
schools.
second. Yeah,
Yeah.
sorry about that. Yeah, I was just thinking, I know in schools in BC, just thinking about the importance of social connection across the life course, they've had this focus on teaching kids more like life skills. So they do these, exercises on mindful breathing and self-regulation, emotional regulation. And as far as you know, has there been anything similar to try to teach kids skills and the importance of sort of social connection in the public school system as a way of trying to really promote these skills early on so that people ideally have them throughout the life course?
Yeah, so certainly our second guideline, really about fostering emotional and social connection at the individual level. At the individual level, that's something that I think parents, communities need to be investing in. At the community guideline that the communities actually take the effort to facilitate that is one of our key recommendations. A core part of that is what we call social and emotional learning. And social emotional learning has been increasing very rapidly in schools throughout North America. I can't speak for every jurisdiction in Canada, of course, but I think some of what you're seeing are investments in kind of the social and emotional thing. I think to some extent, a lot of them that I've seen, if you look at the actual curriculums for good social emotional learning, like Castle Model, and there are lots of models out there, they are very socially embedded. Sometimes things like the mindfulness tend to be a little bit, I think, overly individualistic. And there's actually some emerging evidence that when you educate students, when you train students to have a lot of inward attentional focus of their emotional state, that can actually be quite disruptive. And one of the recommendations that we have given in this, if you go to that Foster Emotional and Social Development page, we have these additional considerations. If you look through our website on, what it means to develop a social, for the individual guidelines, it's under Cultivate Social Confidence, which I'll throw in the chat as well for people who want to take a look at that guideline page. But understanding those processes of social cognition, one of the big issues that we see with a lot of social and emotional skills training is the attentional focus is directed inward. And when you start to look at interventions that actually do a good job of addressing loneliness and social isolation, a lot of them are like encourage pro-social behavior, encourage people to talk to strangers, these sorts of things, because they direct your attentional focus outward. And so I think that, yes, we're expanding social emotional skills as a important principle of education. I think, even early childhood education. We've probably not done enough to make sure that so I think we're still working that out. The well-validated models, I think, do this well. And so, but I think when it's haphazard, it sometimes runs that risk. The thing that we also recommended is that, okay, yes, you've got social emotional learning, but we usually only do that right now in early life course. And I think there needs to be more evidence or more work to help actually educate people across their life course. So you're getting married, so what sort of marriage skills do you need? You're getting divorced. What sort of supports do you need to navigate divorce well? We know, for example, that women tend to do fairly well after divorce, but men tend to not do well after divorce. And one of the reasons that is because society has created norms for women to be the social butterflies who organize social life, and men to sit back and just enjoy that. And so when relationships tend to fall apart, men tend to have the less social support network maintained. And so, for example, we need social emotional learning to help people think about how to navigate that. And then, of course, end of life, retirement. How do you retire well? You see two trajectories in retirement. You see increases in well-being for almost everyone when they retire because they're free of the workplace stress. But then it really goes two directions. If you're able to maintain strong social connections, either to your colleagues that you has spent the last 40 years collaborating with, or you've been able to find other social outlets upon retirement, then you tend to maintain that high level of well-being. But if your social network is deteriorated and you don't have anything outside the workplace and your connection to those workplace relationships are cut off, then you start to see sort of these declines. And so I think social emotional learning is something we need to, of course, substantiate and include in K through 12. But it's also something we need to make sure that community centers and other organizations across the entire life course are preparing people to deal with those major life events that happen, because you're not going to get that in K through 12.
Thank you.
Shadi?
Thank you. We also have a question in the chat I just want to bring to your attention before we go to the raised hand. Are there any more specific guidelines where, for example, the number of connections per week or the number of people I should be close friends with is encouraged? So a bit of that metricization. Kiffer, if you've seen that anywhere in your work.
We want to develop some sort of when we first set out to develop those guidelines, I'll say we were a little naive because I don't come from a background in psychology. My background's in public health and social epidemiology and social ecology. We thought, it'd be great if we could tell people that, that you need a certain number of fruits and vegetables, you need a certain number of friends. And we did find some data, and there are some recommendations that we could have provided that would have been good rules of thumb, but ultimately we didn't. So I'll review those real quickly. We found that loneliness was minimized when people had at least 3 to 5 friends. And then if you had very large social networks, if you had, like, say, 10 people you identified as a close friend, you actually saw loneliness start to go up and increase again, because your average emotional strength or quality of relationship gets weak when you have too many friends. And so you really don't have that sense of belonging or connection because you're spreading yourself too thin. But at 3 to 5 friends, having 3 to 5 close friends appears to minimize a person's experience of loneliness. Same with number of hours socializing. Hunter-gatherer nomadic peoples tend to spend about 20 hours a week just purely socializing with their group. And we actually found in our data that 1 to 3 hours per day of socializing is, again, where emotional and social loneliness were minimized. And then we also found that about 60 to 80% of your social time being spent with your close ties, your strong ties, so that being family members and close friends, 60 to 80% of that's when we saw experiences of social connection or loneliness minimized. If you went above that, if all of your time was just with your close friends and your close family, loneliness started to go up again, because you don't have that broad network, a sense of connection to a broader group of people. So those are good rules of thumb, and we've published those, but we left them out of our guidelines for a few reasons. Is at least with the current data, there's too inconsistent of measurement to do any sort of real meta-analysis on that. Most studies use bins, so they don't have linear, we can't detect the linear effects or pull those. And in our own data, we didn't have good data to back up a substantial guideline. For example, people with anxiety actually were much more sensitive to the larger social networks. And so where we see that increasing of loneliness of people who have 10 or more friends, that happens much earlier, say with people with anxiety. People's social need also changes across their life course. So older adults appear to need a lot less of that broader social reinforcement because of social emotional selectivity. They need less of that broader social loneliness and concentrate more on their emotional experiences. And so again, it differed across the life course. So our guidelines were developed with a kind of a universal design principle that simply encourage people to think about how much social connection am I getting? Think about those internal signals that loneliness is giving you. And are you actually experiencing loneliness? And to try to use that to develop your own tailored response. It may be that, we will be able to develop more refined guidelines for more populations, but at least with this set of guidelines, we did not use a quantitative approach. And that was a conscious decision to be more universal in our design. We would like to give people better advice. We've published a bit on those numbers. I published a conversation article saying, this is what our early kind of data found. But also because these were developed through a Delphi process, we simply just couldn't get the support needed from, in order for any of our guidelines to be passed, they required 80% of experts to agree with the guideline. Some Delphi studies use 70% as a cutoff, but we used the higher bound of 80. And that meant it was hard to get consensus on specific numericals. So yeah, hopefully that responds to that question.
Perfect. Thank you so much. We have a raised hand. Hi there. Would you like to unmute?
Yes, that would be great. Hi, thanks for a great presentation and this fantastic topic. My question is around, I'm part of Youth Wellness Hub Ontario, the integrated youth services, similar to Foundry BC. And it seems like that model is also really trying to create a space for you to come and connect socially. But my question is around, I may miss that. How do you measure that in youth, and how do we flag it? Of course, if they come to a session, they may tell their therapist or counselor or peer support that they are really lonely. But in terms of measuring it through time or something to also measure it, because then if you have data, you can find more funding, all the things. Like, what are your thoughts around those things?
Yeah, and this is, I think, one of our last guideline for communities was to measure and make progress towards social connection, because measurement is there are fine measures. There's the UCLA loneliness scale, which has good across gender. You can use it in young people as well as older adults, and you get a fine indication. Some of those are very small. The three item loneliness measure is something that could be done. Stats Canada, we did some comparison of Stats Canada uses a single item measure of loneliness. Again, it's good enough. How well those will detect longitudinal change is a little bit unclear. We used the De Jong emotional and social loneliness scale for most of our work because it caught the more theoretically developed version of loneliness, and we did find that that captures longitudinal change pretty well. So as well as the larger UCLA scale, so the 20-item scale, those capture the sort of change. So figuring out how to integrate this into clinical practice is really important. I think there's still work to be done to figure out which of those measures is the best and which of those measures is also the easiest to incorporate. But it's certainly something we would recommend to do. And I think not just clinical environments, I think schools, I think, it's a good general indicator of well-being in your community. And you can also use similar ideas like belonging. Belonging and loneliness tend to correlate fairly well. Social support tends to correlate fairly well. I think is what's important if you're designing a measure is you think of the quality of relationships as well as the quantity of relationships and the variety of functions those relationships serves. So this is a framework by Julian Holt-Lundstad around structure, function, and quality as being the three kind of elements that you need to measure people's social well-being well enough. And I think team-based care, such as through Foundry and other integrated youth care models, are one of the places this needs to be piloted, because I think the potential there is so great because you can actually do something about it because you're integrating people into their communities, which is very similar to the social prescribing model that is currently being used in older adults, mostly here in Canada.
Thank you so much. Thanks.
Sorry about that. Thank you very much. I see that we have another question in the chat. This individual is leaning on some of their own experience working alongside older adults, Kiffer, and their question is in and around, for these particular individuals that are very isolated and have high social vigilance, it seems that starting to participate in social activities can sometimes make things worse. Any suggestion for ways to connect these individuals slowly or safely to tackle that social vigilance and distrust of others?
Yeah, I think this is really where, our second guideline to cultivate a healthy social outlook and sense of self really does appear to be critical. And if you remember that slide where these four major types of interventions at the individual level, you could try to improve somebody's social skill, you could try to provide them opportunities for social connection, you could try to increase the social support they derive from their network. The fourth one was addressing social cognition. It does appear, particularly in this chronically lonely group, because if you remember, our basic argument is that an individual experiences loneliness as a naturally evolved response. Loneliness isn't bad. Loneliness is part of your survival system, right? It's there to tell you to go out and get socially connected. it only is when people are unable to act on that motive. They don't have the social resources. They have a disability that prohibits their inclusion in community. These sorts of things that act as barriers. That's when you start to have the triggering of the cycle of loneliness, the chronic loneliness. And that's really where you start to see these problems develop. So you can expect that those individuals do need more intensive intervention and support, particularly around social cognition, which meta-analyses have identified that interventions on loneliness, the most effective of them, are those that address, at least in part, to have a component that addresses social cognition. So I think we really need to think about, how do we use things like cognitive behavioral training, psychoeducation to help lonely individuals understand the experiences that they're having, to understand that, yes, when you're chronically lonely, you're going to get less out of social interactions with other people. You're going to feel anxious when you engage in social interactions with people, but that those are temporary feelings because that's just simply where your social set point is at this moment. By being chronically lonely for a long time, your body has achieved social homeostasis by lowering that set point, by lowering your need for social connection. And so when you bring a person in at that stage, that's where it's going to be really difficult to make those sort of changes. So I think finding low barrier, easy ways of social integration is really the best. That might even start with things that don't look objectively social. We advise in our guidelines that you need to take the step that you're comfortable with. So if right now the only comfortable thing you can do is go sit on a park bench and watch people, that's going to slowly improve your regulation of social, relationships. Then maybe you talk to somebody who's not threatening you at all, talking to a stranger, somebody at the library, right? So, something where it's low consequence. We're even, colleagues of mine at U of T are even using AI as a way to help improve people's social vigilance by giving them a very nice, friendly, accepting, sycophantic maybe AI to kind of build some of that capacity for social comfort, and then ratcheting up the skill difficulty to address that. So I think that this is really about recognizing the fundamental psychology of loneliness does include this social vigilance component, and then treating the patient or the client or the person you're working with, accordingly. And so that means if what they need is a low, easy start, then making sure that we have interventions available for that is really critical. So that might look like small group work, rather than throwing them in at the deep end and saying, let's go to a social, or let's, and a lot of programs are available, arts classes, right? You can participate in an art class, be surrounded by people, have the level of social interaction that you want with others, but mostly focus on your art as a way of kind of introducing. And then I think over time, if the person is aware that their emotional state will change because they've been helped with CBT or other psychological approaches, then they can stick with it long enough to where that social vigilance will eventually become downregulated again. And interventions that do that are the most effective interventions that we've identified.
Great. Well, thank you so much. This actually brings us to the end of this session. We've run out of time together, unfortunately. For those who have some additional questions for Dr. Card, please feel free to reach out to him directly. I'm sure he'd be happy to respond to those questions you may have. Thank you, Dr. Card, for joining us today and leading us in a great, talk and presentation around loneliness, a very timely and important topic to consider. We have put into the chat a post survey that we encourage you to complete to give us some feedback with respect to your experience in today's event. Thank you very much for joining us, and certainly we look forward to seeing you at a future joint event between the Leong centers. Thanks very much. Bye now.
Thanks. Bye, folks.